Kampala. Are you ready? The wait is over. The new shopping giant has arrived.
Welcome to China Mart Supermarket, officially opening this 20th May 2026 at Oasis Mall, first floor, Yusuflule Road, opposite Garden City. Discover a complete modern shopping world with over 35 fully stocked sectors, all under one roof. From home essentials, electronic, kitchenware, beauty products, fashion, groceries, and much more.
And guess what? From the 20th to 26th May, enjoy a massive 20% discount on all products store-wide. Everything you need in one elegant shopping destination.
Enjoy pocket-friendly prices, premium customer care, a modern shopping experience, and ample parking space for your convenience.
Why move from shop to shop when the world of shopping is now in one place? China Mart Supermarket. More than a supermarket, a complete lifestyle shopping destination. China Mart Supermarket. Super much.
Ikop bakube babifanani olikwenda bifanani birungi bakukube bakwize ti oli munoni omukolo bagukolere olina kwandula olina nankani bya wedding olina graduation nibo bofirirwa so kwenda kukola nankani send of decent wesimbye omukalulu decent funaba ikop abo bulwo bayito batako tubateko tuli kujja mukulonda era tibasasula be kale sasula olikwenda bya bululu yes bakukube mukuba ni poster ate bana mukuba poster olikwenda bana dinedo kubutundu bali mu poster anguli mutunigira muko chali wifi ani chali wa mwazira sente yasina nokumuyamba oyo omusada eri ekindi aba ikop olikwenda poster kale bana butundu bali billboard jamba na ife aba business card mudikola nteno naba akolene ya nedo debeta bolochuwa dindi bolochuwa chechimu ne business card ate kalenda muandika ku t-shirt.
Follow us on Instagram at Ecop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
All of the things they talk, I know they care. Say what I do if you know they care.
By the way, what is your name?
My name is Bosco.
Yeah.
Shivara.
Ngagobine nkoko aina katungulu aina nakambi
Basenga babayitote
Bikini mama demo.
obuya
Ela kadebe katu kaneba kama bikini mama demo. Yafudiga dem come over.
These are the cases that I usually want to attend to, but they don't usually come in my office.
naye kiryoke
Lwaki oli mungatemu?
Wemba ngenda okubuka bwenti okusinziira yempa gia n'ensinziira bwenti putulu
Okwesa putu. Bwemira fo. Gwoba oliko yenna. Bamukujjako mufu. Oyaba awedde. Mukuddukako oyinamu ne gia.
Twetaagamuko ku money power. Ngezanga amagi
Amavumbe. Bulaba bekalakasa. Bayingiremu wakati tekawo obuko ogubalagala baveewo. Kino kyenkoze nange neesiba baaba. You do as you wish. Please.
Assalamu alaikum warahmatullahi wabarakatuh. My name is Jeanette Umar Kasule, a member from the Elite Little Hijabis. We are proud of our religion Islam and we believe in decency. I believe we can secure the next generation through the Little Hijabis. Registration is ongoing. Please, our dear parents, bring your children and sign them in for the Little Hijabis. Don't make them miss this one chance that they will have in their entire life. and training will start on 20th of July.
Beyond the hijab. Polygamy mumukwasaganya mutya.
Polygamy atabuka abantu ne bayomba.
Emiswa gitwerega.
Al-khabithatu lil-khabithina wat-tayyibatu lit-tayyibina.
Omukazi omubi
wa
musajja mubi.
N'omulungi wa mulungi. N'ekikuuma obufumbo. Sebyo bye batubuulirira basenga. Nti genda musenge mbuno fumba mbuno mbwa? No.
Ki
one kimutawaanya kitiibwa ki.
Ate ekiri bwe kityo nti Allah buli kyeyateekako essira tekibeeramu bwangu, however kibaamu magezi.
bagiyita beyond the hijab. Waleeno abaana ab'obusiraamu abawala bakubuulira bye bayitamu mu bizinensi. Mbu bakasitoma mubafuna mbu ate bayitirivu naye enninnya gye mulinnyo ennyonyi abaasooka mu bizinensi ze mulimu si bwe balinnyo ennyonyi. Mukikola mutya mu buli ssaawa muba ku busuubuzi.
Nze bwe mba neetuukidde it's cheaper and more convenient nti nfuna kyenjagala ekinsatisfying
bwezo zonna nojja nazo
n'ekibalo kyange n'enkibala.
Beyond the hijab tuli ku executive media. Subscribinga, likinga, bomalo sharinge.
Full body workouts ku Monday gye tubaamu. Keep locked up, come for aerobic classes guys. The class is massive guys.
Fitness mode on. Kigenda kuba kirala. Monday to Friday nga birimu.
Don't miss out. We have the best coaches.
Fitness mode on.
We understand how overwhelming life can get, and that's exactly why we created the Golden Living app. Getting started is simple. Just download the app, create your account, and unlock a world of healthcare at your fingertips. The Golden Living app is your personalized healthcare companion, designed to bring care closer to you, wherever you are, whenever you need it. With just a few taps, you can book doctor appointments without the hassle of phone calls or long queues. Need your medicine? Order it directly through the app. Quick, convenient, and delivered with care, straight from your phone, and even receive your lab results in the palm of your hand. And when it's time for imaging tests like x-rays or ultrasounds, you can schedule them seamlessly right from your phone. Want to monitor your well-being? The app also keeps all your medical records safe and accessible, so you can track your health history anytime, anywhere. And when you need advice, our 24/7 healthcare support is right there. Trusted professionals just a tap away. But the Golden Living app goes even further. Need urgent help? Our quick emergency feature connects you to support in minutes. One of our most thoughtful features is the Peer Reminder. Free, simple, and easy to set up. It helps you stay consistent with your treatment and ensures you never miss a dose. And it's not just for you. You can also support family and friends, especially loved ones who may need a little extra help remembering. Because caring for your health also means caring for theirs. The Golden Living app was built to make healthcare simple, accessible, and reliable. It's about giving you peace of mind, saving you time, and making sure your health always comes first. Download the Golden Living app today. Available on both Google Play and the App Store, and discover a new level of healthcare convenience. With the Golden Living app, every second counts.
Diggy 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 da 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 diggy da. Wanna back to dance floor, come take it. Diggy 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 da 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 diggy da. Big a biggie biggie boy, come pepeta. It's a girl Karakasita, Mama Sita at King Mama, and Duanoko Executive Media on the RealTime show with the Gal Mini. Don't touch the dial. Maximum to the world.
Doctor, a first mother out there with a kid, how do I tell that my kid has hernia?
Yeah, that's a great question. Mom would look at the groin, and the groin is anything below the umbilicus, or the umbilical cord. Say, So anything below that, you are coming towards the groin. So usually you would see the swelling, either when the baby cries,
Okay.
or when the baby coughs, or when the baby is stooling or urinating. Okay, and sometimes they may not be doing any of that, but the hernia comes back. And sometimes they may be sleeping and the hernia shows up.
So I have to be monitoring that.
Exactly. So mom would be always very vigilant to be, checking intentionally the spaces of these children to make sure that when they are crying, there is no hernia, because sometimes they could cry because the hernia is there, or they could cry and the hernia gets stuck or becomes prominent. So that is usually something. If a child is vomiting all the time, the child is not
It's also a
stooling.
sign.
Yes, sometimes if the hernia is stuck, the baby can vomit out of pain or out of obstruction. So mom is always going to look at if the baby is vomiting, if the baby is distended, the abdomen is distended, they are not passing stool or gas. Those could be reasons coming from a hernia being stuck. So mom would always look out for those things. Yeah.
So when the kid is not doing stool, is it a sign that he or she has hernia?
Not necessarily. There are
Because most of the kids get that problem when they are still young.
Correct. So kids learn how to use the bowel. You see?
Yes.
Kids learn how to use their intestine and use a bowel to open bowel. It's a learning experience. So some of them can hold the stool unintentionally or intentionally, but it's not necessarily because they have a hernia, so the stool is not present, but presence of a hernia could result into ink of stool.
So nsubira buli omu ali bulungi kiri mu kamera nkola.
Akulindemu omuntu bw'aba akola mulinde.
Abadde ogamba ki wamma? Okay, Shame Manja lye linnya lyange. Don't worry about me. I first talked to them in Uganda because most of the women here and the mothers and the fathers on this app, they normally need it in Uganda mostly. So first I do the introduction in Uganda, but again we're going to be speaking in English. But if you feel like saying anything in Uganda for them to get it better, you can say it in Uganda.
Great.
Because most of the mothers, they will need it in Uganda. Shame Manja lye linnya lyange, oli ku Executive Media, tuli ku TMR Golden Living Specialized Clinics wano Naalya. Oli ku Executive Media bagiyita Health Chat. Health Chat tugikola okulaba nti tubayambako okubanga mumanya ebintu ebimu. Dr. Eladu abeera wano okwogera ku fertility, twakyazaako Dr. Charity n'ayogera ku cancer. So ne leero tulina Dr. agenda kubeera ng'abeeyanjulira, tugenda kwogera ku hernia. Abasinga hernia buli omu ayina engeri gya mumanyiimu. Buli omu abamu balowooza ddogo, abalala balowooza kidissolvinga kibula kizimba. So tugenda kwogeramu ne Dr. agenda tubuulira hernia ekituufu kye ki. So I'm happy to be here with you, Doctor. Can you please tell them your names?
Yeah.
Oh, if it is okay, I don't think it is okay for him to say his names, but he's going to teach us about hernia so that we cannot be green about the disease. So, Doctor, I'm called Shame Manja. I'm your host today, and I would like to know more about hernia as a disease. May I call it hernia?
Yeah, so that's great. It's exciting to be here with those people listening to us today. And hernia in children is a very common surgical condition that we've experienced so much. It's something that demonstrates a weakness in the abdominal wall, and through that weakness and that defect, the contents of the abdomen find their way through that defect and get to other spaces where they should not be situated. So those are called hernias. They could be in different places. The most common place is the groin, but you could also find them in places like the umbilicus. You could find them in the lumbar area. You could find them around the heart, and you could also find them.
Heart.
Yes, you could also find them around the diaphragm. So
Wow.
they could be internal or they could be external. When we talk of hernia, it's just a general word that stands for a defect.
Okay.
Yes.
We only know that hernia is always under the umbilical cord or up the umbilical cord. So when you say hernia in the diaphragm, hernia in the heart or on the heart, we get scared. Is it still also hernia? How do I know that now it's hernia?
Yes. So the hernia part is something that we give as a general term. Now, depending on where they're located, we can give them different names.
Okay.
So hernia in the diaphragm is called a congenital diaphragmatic hernia or a diaphragmatic hernia. Hernia at the umbilicus is called an umbilical hernia. Hernia in the groin, it could be called groin hernia or inguinal hernia for that reason, or a femoral hernia or a pituitary hernia. But all those hernias are given names based on where they are located.
Okay.
And with their treatment also follows their names. Because if you have a hernia called an inguinal hernia, its treatment in a child will be done based on that name, where it's located.
Okay.
So generally, the treatment for these hernias, the most common way of identifying these hernias is by looking and touching. And babies may not complain that they have hernias. So it's upon the parents, mom especially, dad as well, or anyone
To
staying with a
identify.
child to identify these defects, these hernias, and by touching or looking. So anytime a child has a scrotal swelling, these are swellings. Could be in the scrotum, could be in the other parts of the groin. You may not see the diaphragmatic one, but those also cause different symptoms based on where they're located.
Are they identified? Can they be identified, those ones in the diaphragm?
And not by mothers, but
By doctors.
by the doctors, based on how the child is presenting.
Okay.
Yes.
So what causes hernia?
So depending on what type of hernia, but usually it's going to be found in children that are preterm. Like for example, in many preterm children that are born before their term, you will find that these holes have not closed. So they have all these spaces. Now in those that have gone to term, you could also find they also have these weaknesses. It's not something that they have done or not done. It's generally a weakness that is created by the development of these parts. So they leave behind a hole as things go through those defects. So these hernias serve as passages of things moving across them. So sometimes they persist and don't go away when something has already gone, but these defects, these holes, stay and don't go away.
They are holes?
Yes.
Oh, they are not swellings?
They are holes, then they get swellings in them.
Okay.
Contents come into there. Yeah.
Because
through
the hernia up the umbilical cord, sometimes when you see it, it looks like a balloon.
Yes.
Why?
Yes.
Sometimes.
So, because the intestines or other parts of anatomical structures within the abdomen have gone through that place, or they have herniated and gotten into that space and stayed there. So that's where you find that they are swollen, and then they can reduce, go back.
Yes.
And then on another time you find they're swollen.
Mm.
So depending on how much pressure is in the abdomen, contents can come and settle there.
Okay.
And sometimes they get stuck.
Sometimes they are not painful.
Yes.
Sometimes they are painful. Yeah. Why is it that sometimes it is painless and sometimes the patient feels the pain?
Yeah. The vast majority of hernias will be painless. But they are,
that's the first stage?
Yes. They are uncomfortable.
Mm.
You may find that the hernia just keeps coming and going back. That's called a reducible hernia.
Reducible.
Yes.
Mm.
And so that usually does not, offer a threat to the child's life.
Okay.
But these hernias can change state, meaning they can get stuck.
Mm.
One hernia that used to go back and forth no longer does that for some reasons. And then it cuts off its blood supply. It kills that part of the intestine that has gotten stuck in there, or anything that got stuck in there will cause pain. Anytime you have something stuck and it doesn't move, then those will cause pain.
Okay.
And others have fluid in there, and those may not necessarily cause any pain, but the fluid keeps coming back and forth because there's a connection with the peritoneal cavity.
Mm.
So those are called persistent or patent ductus, patent ductus. So those are PPDs. So those would generally cause you fluid coming back and forth.
Mm.
Okay. Yeah.
So do newborn babies, like new mothers, they are newborn babies with those big umbilical cords. Is it also a sign of hernia?
So the big umbilical cords may not necessarily be a hernia, or maybe what we call an omphalocele, which is more of a congenital problem, that part of the abdominal wall did not form very well.
Okay.
And so part of the contents of things that are supposed to be within the abdominal cavity found themselves outside. Because as you know, during child development, almost everything within the abdominal cavity comes out and goes through a certain degree of rotation and goes back inside. So sometimes you find that these defects that at one time were useful as the child grows do not completely cover, or they are covered with a membrane over them. And that is called an omphalocele. So that part of the abdominal wall did not develop, and so contents are stuck in there and covered with a membrane. So that would be called an omphalocele. And sometimes that membrane may not be present.
Okay.
And all that intestine is just hanging out, and it's not covered by anything. And that's called a gastroschisis.
Is it scary for mothers?
I think, of course, because sometimes those conditions are not found before the child is born. They are discovered after the child is born, and that could be a little bit scary for the mom. Yeah.
So do you know a saying in Luganda which says that if the unborn baby, like the baby is reaching like 2 months and that umbilical cord is still big, that the uncle can step on it and it goes back?
No, I have.
You've never heard about it?
No, I've not heard about that.
You've never heard about it?
No, I didn't get a chance to hear about that.
Yeah, you should ask about it, because I was told that if the umbilical cord is big, you get like my brother. If the baby is mine and the umbilical cord is big, I call my brother, steps on the umbilical cord, it goes back.
And then it comes back. Because when it steps on it...
I've never tried it. So I wanted to know what's inside there in the umbilical cord, so that that makes us believe that when you step it on it, it is going to go back?
So I will come back to that. The vast majority of umbilical hernias actually go away.
Okay.
As opposed to the groin hernias. So the umbilical hernias, if a child is born with those, some of them would actually disappear before age 5.
Okay.
If they persist, then there's reason to operate on them. Likely they will not go away. And those that have are like an elephant trunk type, where you really see that it's quite big,
yes,
and forming like a trunk of an elephant.
Yes, it passes through the clothes even.
Exactly.
Yes.
Those don't usually go away easily because the defect is quite big. However, what is in those hernia defects? It's usually going to be intestine, okay? Or they have a sac around them that overlies the intestines. So when you operate on them, we make sure that the intestine is reduced, the sac is reduced, and the abdominal wall is repaired.
Okay.
There are coverings over the abdominal wall that we repair those and close the defect. Most of them will not come back. Yeah.
So is hernia genetic?
That's a great question. Some of them are genetic.
Some are not?
Some are not.
Wow.
So if you talk about things like congenital diaphragmatic hernia, those could be found in some families. They generally have, some people have had them in the past, or they have had, diseases that would predispose them to having this in their family, or a certain genetic mutation that would predispose them to easily having congenital defects.
Okay.
So those could be congenital, yes. Yeah. And others could be just as a reason of prematurity.
Premature kids.
Premature children. Yeah.
Okay. So we are talking about hernia. Twogera ku hernia. Abasinga mugamba hernia bamuloga, hernia dissolvinga nabula. So ndine dokita wano mubuuze ebibuuzo byammwe naye oluzungu lungi mukko, so mujja kukitegeera bamikwano. So doctor, a first mother out there with a kid, how do I tell that my kid has hernia?
Yeah, that's a great question. Mom would look at the groin, and the groin is anything below the umbilicus, or the umbilical cord, say. So anything below that, you are coming towards the groin. So usually you would see the swelling, either when the baby cries, okay, or when the baby coughs, or when the baby is stooling or urinating. Okay, and sometimes they may not be doing any of that, but the hernia comes back. And sometimes they may be sleeping and the hernia shows up.
So I have to be monitoring that.
Exactly. So mom would be always very vigilant to be, checking intentionally the spaces of these children to make sure that when they are crying, there is no hernia, because sometimes they could cry because the hernia is there, or they could cry and the hernia gets stuck or becomes prominent. So that is usually something. If a child is vomiting all the time, the child is not
stooling. It's also a sign.
Yes, sometimes if the hernia is stuck, the baby can vomit out of pain or out of obstruction. So mom is always going to look at if the baby is vomiting, if the baby is distended, the abdomen is distended, they are not passing stool or gas. Those could be reasons coming from a hernia being stuck. So mom would always look out for those things. Yeah.
So when the kid is not doing stool, is it a sign that he or she has hernia?
Not necessarily. There are
because most of the kids get that problem when they are still young.
Correct. So kids learn how to use the bowel.
Yes.
Kids learn how to use their intestine and use a bowel to open bowel. It's a learning experience. So some of them can hold the stool unintentionally or intentionally, but it's not necessarily because they have a hernia, so the stool is not present, but presence of a hernia could result into into lack of stool, and then eventually vomiting.
Does
or
it cause
distension.
constipation also?
Hernias could cause constipation. Sometimes if the child is not able to stool because they have pain or the hernia is stuck, they would have problems with moving the bowel. Yes.
So there is no any way we can prevent it?
No, it's not because what you've done, but early detection results into early treatment, which results into less morbidity and easy surgery.
Okay.
So we encourage that mothers looking out to their kids' groins, to their kids' umbilicus. They may never see a diaphragmatic hernia that would manifest differently, and that would be caught by health workers. But for as long as the child is not passing stool, is vomiting, has abdominal distension, has diarrhea, constipation, or having blood in stool, these are some of the things that could be causing mom to think about a hernia or anything else. But these are very abnormal signs that mothers should recognize and quickly get their children to the hospital for care and examination.
At what age do you do the surgeries for the children?
Specifically, if hernias are some hernias associated with some other things. They may not be just isolated things.
Like?
So they could have undescended testes or hydrocele as well.
What is hydrocele?
Hydrocele is hydrocele is just fluid around the testicle.
Okay.
And that fluid can be as a result of that sac may be stuck there with fluid, or it may be a connection as well between the peritoneal cavity and the scrotum. Okay, so that still is a hernia, but sometimes it may not necessarily be a hernia, but it's just fluid collecting around the testicle. And that could be previous fluid that came in there, or it could have been an infection or something. But those are also swellings around the scrotum.
So do you do the surgery?
Yes, we do the surgery.
If you identify it?
If we identify them.
When it's just a newborn baby?
Not for hydrocele. For hydrocele, if say the hydrocele is non-communicating, it has no communication with the peritoneal cavity, we generally don't rush to operate on those quickly because some of them will actually resolve. But if we have a communicating hydrocele, then yes, that's a hernia and may need to be fixed. Now, we would prefer to have those fixed when it's anesthetically safe and surgery is easier. And those would probably delay a little bit between 6 or 1 year to operate on those if they are non-communicating.
And if they are communicating?
If they are communicating, if they are preterm babies, we want to do that sooner.
Like when?
Like before they leave the hospital. I would prefer that those hernias are fixed.
It can be
if it's
done on a 1 week?
Sorry?
On a 1 week child?
It could be done on a 1 week, but we try as much as possible to delay those until when it's anesthetically safe. But I make sure that preterm babies do not generally leave the hospital without
the
surgery, or if not the surgery, without assurance that someone will quickly identify a problem that they are stuck and get them back easily. Okay. So sometimes it's not safe to operate on the preterm. And most of the time it's not, because they have all these other congenital problems that are going on that cause the prematurity. So anesthetic-wise, putting them to sleep is harder. So we try to buy time so that they reach a safe age and then we can operate on them. But usually those hernias really need to have surgery.
Okay.
Yeah.
So doctor, hernia surgery is always painful for the patients, and every patient who comes out, the kids say it is so painful, mostly after the surgery and the recovery process. Yeah. Is there any other way that you've got for hernia patients after the surgery for the recovery process?
Yeah.
Those threads are so painful.
Yeah, so I have some good news for you today.
Wow. That's good.
Hernias are no longer painful. Those days are gone. It's
Wow.
old surgery when people feel pain.
Yeah.
Pain is actually completely off the radar now in terms of having patients go away saying that, oh, we were in surgery and now we have a lot of pain or blah, blah. So good news is that we have medication, we have methods, we have strategies that we deploy to prevent pain, post-operative pain and intraoperative pain. We have ways to mitigate that. And I think that's, we have very modern medicine. And then after surgery, we put freezing medication
on the wound.
On the wound.
Okay.
That helps you to be pain-free for at least the next 8 hours after surgery.
Okay.
And then we give you pain medication. Now, if medicine is not scheduled after the operation, that's where the problem comes. You should not let your patient have pain after surgery, because controlling that pain that has escalated is harder than preventing that episode. So we usually make sure that patients are pain-free. And sometimes we have acute pain service that would help make sure that the child is well taken care of. And they have the best anesthesia, they have the best pain medication after anesthesia.
Do you still pluck out the threads?
No, that's old surgery. That's why I'm saying good news. We no longer do that.
What do you do now? Because the kids, everyone feared the surgery process.
We never bring I will tell you that that's exactly what I'm saying. Good news for you guys out there that used to think we are going to remove threads.
Yes.
It's a painful process of removing threads. We no longer put threads that require removing.
Wow.
We put threads inside. First of all, you don't see them.
Yes.
You come out and you check where the hernia was, where the cut was. You
Nowhere
probably
to
don't
be
see
seen.
it.
Oh, wow.
Yeah.
Good news.
So that's one way that is modern now to operate on hernias. The other modern way is using laparoscopy, using a camera.
Very expensive, not so?
I don't know, it depends on where you are. But, but usually that's also a good given modern technique.
Yes, very.
So that we just put a camera inside and go in there and get these hernias back and close the defect from inside.
Yeah.
Not outside.
Not outside.
So on the outside there is a small scratch because we put the needle through there, but everything has been in the inside, so you don't see it. Okay. That's a good way. Most issues with that is not the expense, but the technique. So if the surgeon knows that technique very well, then I would, it's a good technique. Now its results are not inferior to the usual open hernia.
Old-fashioned surgeries.
It is not superior.
Very good news to the hernia patients. So it's now not scary like it used to.
Not anymore. Yeah.
How long now is the recovery process? Because last time it was a bit like a month.
Yeah.
Yeah, waiting for those threads to be plucked out and everything. So now how long?
Hernia surgery is usually day surgery. Like you walk in and walk away.
The same day?
Yeah. You generally, if all goes well, we don't usually have those children sleep around or hang around. No, they come in, we plan. The thing is, it's about planning. If we are planning with the parents, it's going to be, day surgery. If we don't plan with the parents, then it's going to be an overnight stay or something like that. But if we have been planning with the parents, you walk in with your baby,
you go back with the baby,
put them to sleep quickly in the morning, we give them the surgery, somewhere in the afternoon or when they are fully awake, they go home. Now for the majority of kids, that should be okay. Then kids that have prematurity, or kids that have other things associated with the hernias, those will definitely have to stay around. But usually they should be able to go home. And for me, if you are if you are looking at families that are a little bit in a different, better economic status, those families may not necessarily see you again, unless if they have a problem.
Why?
Because there's no problem. 95% of those kids will have no need to see a surgeon after that.
Okay.
But they can see their primary health care physician.
But they said it's recurring. It's not true?
There's a chance that it will recur, like there is very small percentage, but in children, that percentage is very, very low.
It's
very
not
low.
in children mostly, but it's in the adults.
Adults, yes, the recurrence rates are high depending on the technique you've used to repair those. In adults, the repair usually includes a mesh. That's called a Liechtenstein repair.
Okay.
It includes a mesh or a mesh repair.
Why does it recur?
Recurrence is because the weakness is still there. The posterior wall is weak, and so it keeps being weak. And if you don't use a mesh to reinforce on that repair, then it usually has a higher percentage. It could go as high as 25% recurrence rates.
Okay. So have you heard that hernia patients, we lose a lot of hernia patients in the surgery room because of high blood pressures and everything?
Yes, I've heard of that. Not in children. I've not.
Not in children?
Usually children do not have much in terms of other associated problems, in terms of hypertension and heart disease and all that stuff. So the hernia is going to be a simple defect. You close, you don't even repair the posterior wall. You don't need mesh. You just tie off the sac, drop things back, and you're done.
Okay.
For adults, it's a little different. They walk in, they have prostate pathology. Sometimes they may be having a hernia because they can't pee.
Yes, mostly men.
And so they're pushing, so they develop the hernia. Other times, they have cancer that, is seated in the rectum. And they're constipated, they get hernias.
And most hernia patients in adults do have cancer.
Yes, and other things.
Yes.
So they are not free. So if someone comes to me as an adult with a hernia, I'll definitely screen them for other things as well.
Before the surgery?
Correct. So that I'm sure I'm going to be dealing with an isolated problem. Okay? So then I always make sure that their heart is good, coronary disease is controlled if they have hypertension, if they have diabetes, if they have other problems. I make sure that those are really, really treated first. If they have peeing problems, I make sure that they are peeing first before I repair their hernias.
Okay.
Because the hernia chances of coming back are very high if I don't repair those underlying problems that might have caused the hernia.
It's that serious?
Correct.
Okay.
So my care for adults
it's
is
different
quite different from the care of children with the same disease.
Okay. So because sometimes they tell us that if you give them local medicine, that hernia thing can dissolve.
Yeah. So I would say that if there is any swelling, that is the bottom line. If there is any swelling on the child, no child should have a swelling.
Wow.
Okay? If you notice a swelling, please seek medical attention. If you notice things that I mentioned before, that would be, emergency situation type of things like vomiting, bloody stool, abdominal distension, diarrhea, not wanting to feed, not wanting to sleep, those kind of things. Yes, those need you to immediately seek for medical attention. But most of the time, those are not the presenting signs. The presenting sign is a swelling during crying, or you are showering, bathing the baby, you see some abnormal swelling or something. The testis is not in the scrotum, or sometimes you might have acute scrotum. Do you know what that is?
No.
So acute scrotum are things that would create pain in the scrotum abnormally. And then you for some kids, their testes might toss, like twist on their blood supply and kill it. So I would say mothers would be very vigilant on that. If the child gets acute pain, the scrotum, then they really need to quickly seek medical attention, because that could be as a result of a tossed testis, and we have to save it. Now, testes that have grown inside the abdomen, which means intra-abdominal testes, mothers have to make sure that they seek medical attention quickly, because those over time they may cause infertility or increase the risk of cancer.
What about the boys? boys who miss their tests and the bag sometimes it has one test, other times it has two,
Yeah.
sometimes it has one, and the baby also gets pass sometimes.
Pass.
Is it infection or it's about hernia
Pass
also?
where?
Pass in the susu.
Oh, in the susu.
Yeah.
Yeah, the pass in the susu. Most kids suffer from urological problems, and that said, they may suffer from upper or lower urinary tract infections,
Okay.
and that could be as a result of an obstruction within the collecting system or somewhere, and so you have to rule out things like posterior urethral valves and failure to pass urine or UTIs or other causes of UTIs in children. UTIs, urinary tract infections, need to be investigated. They should not be overlooked.
Okay.
So if a child has passing urine, that is a serious thing that needs to be investigated.
Okay.
Because we do things to make sure that that there is no other underlying causes of
What
problem.
about missing tests?
Now, missing testes as a common occurrence.
Okay.
So mom should touch the scrotum. By majority of the kids should be born or at least should have their testes present in the first year of life.
Okay.
If they don't have the testes present, if they are mature, if they are born at term, all the testes should be present. If they are not present, then we need to look for the other testes. Both may miss or one may miss.
One.
Okay? So if one is missing, we have to look for the other. And usually that needs to be done at least within the first 6 months to a year so that we reduce the risk of infertility that may come later on, or reduce the risk of cancer, or at least if the risk we don't mitigate on the risk, we know that the testis is brought down where we can see it in case it gets cancer.
It is always in the body. Can you find it if the mother?
The vast majority of the time, yes, that testis is intra-abdominal gonad, that we use surgery or we image first.
And see where it is.
Yes. Make sure it's not in the groin. Vast majority is in the groin. Or at the internal ring, there's a small ring where the testes go through. And or the other time, it's really directly into the abdomen. Okay.
What if sometimes it misses and then sometimes the mother finds them two in the bag, but sometimes it is one?
Yeah.
What's that?
Yeah. So sometimes that testis might ascend and come back. So when the temperatures are low, the testis is down. When the temperature is when the temperatures are high, the testis is down, and when the temperature is low, the testis is up.
Which temperatures, doctor? Sorry to ask.
The
normal
yes, the normal environmental
Oh,
temperature.
the normal environment.
So that testis may not necessarily go back into the abdomen. It may hang around in the groin, but that's called, but it comes back into the scrotum. Now that is called, that's called a retractile testis, meaning it goes back up and comes back in the groin. I mean in the scrotum. But then there are testes that will not be in the scrotum. And when you bring them in the scrotum, they won't stay, or they can't come to the scrotum. Those are called undescended testes, and they need surgery to be brought into their usual anatomical location.
So there is nothing to scare me about as a mother if my child has a missing tests, that today it's on and off, like it goes and comes back.
Anytime
You don't need to see a doctor.
You need to, so that you are given a good exam and you ask the right questions so that we give you reassurance and we give you safeguards of what to do in case there is a change. Because this testis that keeps coming and going back, sometimes it has a bigger risk of twisting around. You see? So you need to make sure that the doctors examine that testis, and sometimes it may not be in the scrotum, it's not in the groin, but it's on the side. That is called an ectopic testis.
Oh.
Yes.
They also have ectopic?
Yes.
Men?
Yes, that's an ectopic testis.
Wow.
So it is not in the groin, it's not in the scrotum, it's not in the abdomen, it's somewhere on the side. That's an ectopic testis. So
then that's a surgery, cause
yes,
for a
that
surgery.
requires surgery
Okay.
to bring it down into its rightful place.
Okay.
Yeah.
So with this new era of surgeries, that good news that you've given us, so is there any specific treatment after the surgery that every hernia patient needs to come back after the surgery, or it is okay after the surgery to stay at home and don't come back in the hospital?
The reasons why we want to see our patients, any patient after surgery, are not many, especially after this type of surgery for hernias.
Yes.
You want to see them for things like surgical site infections to make
Wow.
sure that didn't happen. Okay? Hernia surgery is clean surgery. It's a class 1 wound, meaning generally doesn't need antibiotics.
No cleaning?
No
Of
cleaning.
the patient, like
no,
me, I have to clean everything.
No, it generally doesn't need any further cleaning apart from how you wash your body. So class 1 wounds are generally safe. They have a small risk of infection, which could be less than 3%. It's there, but very tiny. So those we don't necessarily need to see them come back. Now, we give the parents or give the patients some of the risk signs, or signs that would point towards an infection, a complication.
Okay.
Redness, if you see redness, swelling, bleeding, flank pass, okay, then those could be signs that, or a wound breaking down, those could be signs of
I
complications.
need to rush back to the hospital.
Correct. So if none of those are present, so like I told you, the risk of complications is very low. Therefore, I don't generally need to see that patient. The vast majority are in the bracket of no complication.
Okay.
So I only ask them, come back if there is need. Otherwise, see your primary healthcare physician.
Oh.
Okay?
Okay.
They will help you out.
Okay.
Yes.
So is it okay for the child to do his all her normal playing, everything after the surgery,
exactly.
or he needs to rest?
So children will actually lead the way. When they're okay, they'll just play right away. If they are not, then. But I always advise parents to give children scheduled medicine for the first 3 days, like scheduled pain medication for the first 3 to 5 days, and then as needed thereafter. So in general, those patients may not necessarily have trouble. They may play right away when their pain is controlled. So you can't limit a child from doing what they want to do because you've given them surgery. They will definitely be leading the way.
Okay. Anything you would love to say before we close?
I am just happy that I had a chance and an opportunity to talk to the community about such common occurrences that could generally be treated if identified early, could be treated without morbidity, easy surgery, no complications. And your child, if you recognize these things early, your child stands the best chance for a better future health. They're going to be healthy in the future if you identify these things early. It's not because children's illnesses, especially surgical illnesses, most of them can be cured with surgery. And surgery doesn't mean a cut always. It may be something different. But the vast
Doesn't
majority...
mean death.
Yes. You see,
Every
and
parent.
surgery has evolved over time. Just like things have evolved, likewise, surgery has gone through a lot of transformations. It's safe, it's good, it's efficient way of caring for your surgical illness, and it has complications, of course.
Yes.
But those are manageable complications.
Okay.
Yeah.
Okay, munzikirize Dr. Musibule tubadde twogera ku hernia. Hernia tadissolvinga wabula olina okujja mu ddwaliro olabe omusawo. Bakyusizaamu mu ngeri gye balongoosa hernia era Dr. atuwadde amawulire amalungi nti kati tebakyasika muwuzi. kati basobolera ddala bulungi okukolako ne bakuwa n'otawulira ku bulumi mpaka bw'owona. Era dokita agambye nti asobolera ddala okulongoosa omwana nadde waka n'azannya olumu tekikwetaagisa na kudda mu ddwaliro. Bakulongoosa ku makya n'omwana ate ne muba nga olweggulo muzeeyo. Thank you so much, Doctor. I'm humbled. Thank you for sharing with us.
Great.
Yes. So, munzikirize mbasiibule, musiibe bulungi, mweraba.
Executive Media. Focus, innovate, succeed.